We do know today that when it comes to the question of repairing incisional and ventral hernias, the preferred option is the use of a mesh, polypropylene or PTFE. Regardless, we still also know that recurrence rates are high and can be as high as 25 to 35% in some series. In the last 10 years or so, laparoscopic approaches to repair have been popularized. However, despite the popularity of the laparoscopic approach, there is as yet no scientifically evaluated consensus about the value of one approach over the other, namely the open over the laparoscopic. In this study, the authors have looked at the published literature on this subject, and after an extensive search were able to cull articles that they then classified as being either low quality or high quality based on an objective scoring system. Of the 11 randomized controlled trials that they were able to identify, 6 were of high quality and 5 were low quality. The authors looked primarily at two variables. They compared open repair with laparoscopic repair, and on the basis of these published 11 studies were able to cull approximately 500 patients in each arm. The outcomes were analyzed over a wide range of parameters, and the study found that as far as wound infection was concerned, the laparoscopic approach was significantly better, but when it came to the issue of bowel injury, it did look like the open method had a degree of safety that was significantly greater than the laparoscopic. When looking at the primary item of concern, that is recurrence, the authors could not find any difference between the two methods, but they do accept that the period of follow-up for a problem such as this is relatively short. The range as far as this study was concerned was between 2 and 35 months, which may or may not be adequate. Looking at a wide variety of other parameters, they found, as was to be expected, that the laparoscopic approach had some superiority in terms of the length of hospital stay, but it didn't make much of a difference in terms of operating time. Approximately 10% of all the laparoscopic procedures had to be converted to open procedures. When you look at the methodology of the study, this is a relatively large series, almost 1,000 patients, but it is a retrospective analysis, and this comes out from a teaching hospital in China. The crux of the study is the comparisons, and in this regard, the study was well done in terms of the fact that all the issues looked at were from the basis of randomized controlled trials. The two groups were comparable in terms of age, body mass index, and the size of the hernias. There wasn't much by way of comment in terms of what was measured. The outputs measured were relatively easy and stable measures. The authors therefore conclude that laparoscopic incisional and ventral hernia repair is a feasible and effective alternative to the open technique, but they do caution us that the incidence of bowel injury is significantly higher in the laparoscopic group, and they also are concerned about the fact that the period of study in most of these trials is still relatively short and that we need larger, longer trials. So putting it all together, considering all the issues, this paper is a reasonably safe paper.